When most people experience chest pain, the first thought that comes to mind is a heart attack, and while chest pain is indeed one of the most important warning signs of a cardiac event, it is essential to understand that not all chest pain is heart-related. In fact, there are many possible causes, some minor and others life-threatening, and knowing the difference can save your life. Let's break this down step by step. Chest pain due to heart problems generally occurs when there is reduced blood flow to the heart muscle, most commonly because of blocked or narrowed coronary arteries, leading to conditions like angina or myocardial infarction, which is the medical term for a heart attack. The classic heart attack chest pain feels like a heavy, squeezing, or crushing pressure in the center of the chest that may radiate to the left arm, jaw, neck, or back and is often accompanied by sweating, nausea, shortness of breath, and a feeling of impending doom. However, not all heart-related chest pain is severe. Sometimes it can be mild or mistaken for indigestion, especially in women, elderly patients, and diabetics, where symptoms are atypical. Apart from the heart, other organs in the chest like the lungs, esophagus, and even the chest wall muscles can cause pain. For example, acidity or gastroesophageal reflux disease, GERD, can mimic heart pain, where stomach acid flows back into the esophagus causing a burning sensation known as heartburn. Anxiety and panic attacks can also lead to sharp chest pain associated with rapid heartbeat, sweating, and breathlessness, which often feels like a heart attack but is not life-threatening. Then there are musculoskeletal causes such as costochondritis, which is inflammation of the cartilage connecting the ribs to the breastbone, leading to localized chest tenderness, and pulmonary causes like pneumonia or pulmonary embolism, where a blood clot in the lungs causes sudden sharp pain and breathlessness, which is a medical emergency. So how do you know when to worry? Any new, unexplained chest pain that lasts more than a few minutes or occurs with exertion, shortness of breath, fainting, nausea, or sweating should always be treated as a potential heart emergency until proven otherwise. At the hospital, doctors will perform an ECG to check your heart's electrical activity, a blood test for cardiac enzymes like troponin, and possibly an echocardiogram or angiography to confirm or rule out heart issues. Meanwhile, if the pain is due to acidity, lifestyle modifications such as eating smaller meals, avoiding spicy or oily foods, and not lying down immediately after eating can help. If stress is the culprit, relaxation techniques, regular exercise, and breathing exercises are important, and for musculoskeletal pain, rest and anti-inflammatory medications often provide relief. Remember, chest pain should never be ignored or self-diagnosed because even experienced doctors cannot differentiate every time without proper testing. So the safest approach is, when in doubt, check it out. If you or someone near you experiences sudden severe chest pain, especially with symptoms like sweating, breathlessness, or radiation of pain to arm or jaw, call emergency services immediately. Time lost is muscle lost when it comes to heart attacks. So to summarize, chest pain is not always a heart attack, but it is always a reason to pay attention, understand the risk factors, recognize warning signs, and act quickly because early detection and treatment save lives.